Hello and welcome to the beginning of the end here. This is Shay Cunningham coming here from St. Louis, Missouri, and I'm going to be presenting my theory review and application presentation today for my theories class with Dr. Murphy. My presentation is going to address period poverty. So why don't we go ahead and start with our objectives. What we're going to go over today will be first the definitions and terminology regarding menstrual health, as well as the importance of looking into period poverty as it relates to health education. We're then going to take a moment of personal reflection regarding this topic, and then we're going to look at period poverty from two theoretical perspectives. We're going to look at period poverty from the ecological model, and then we're going to review period poverty from community engagement perspective. After that, we're going to do an analysis of the two models and looking at the implications for health educators, and then we'll conclude with some final thoughts on the topic. So let's go ahead and get started with some definitions. We'll first start with the definition of period poverty. So period poverty, it's hard to find a true definition that everyone agrees on. So there's a lot of working definitions, and because a lot of research that you're going to find on the topic is not going to be any more than 10 years old. Most research has been done in the past 5 years. So we're going to define period poverty as the inadequate access to menstrual hygiene tools and education, including but not limited to sanitary products, washing facilities, and waste management. So what we're basically saying here is that it's the lack of ability to get any kind of period supplies, whether it be tampons, pads, panty liners, menstrual cups, and it could be for several reasons due to living circumstances where you live, income, and it can also be you may not have the menstrual health education, so you're unfamiliar with how your body works, and you may also not have clean water where you live, and you also may not have proper disposal methods of your period products. So all of that, any of those or a combination of those will be defined as period poverty. You will also hear other phrases used instead of period poverty. You'll hear menstrual health inequity, period inequity. We're trying to kind of get away from the idea of poverty just because it has such a pejorative connotation with it. So those are some other phrases you will also hear. Moving on, another definition that you'll hear often is menstrual health. So menstrual health is going to be a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in relation to the menstrual cycle. So this sounds, if you recall, a lot like World Health Organization's definition of health. So the World Health Organization defines menstruation as a health issue and not just a hygiene issue. So it's not just merely about cleanliness, but that there are, as mentioned, physical, mental, and social well-being issues that go along with menstruation. And if you have any questions about terminology, I would look at Hennigan's resources here. That resource provides wonderful working definitions of menstruation related topics. So there are also, within menstrual health, there are 4 things that are related to menstrual health in order to achieve optimal menstrual health. And these 4 principles need to be present. One would be access to education, access to water, sanitation, and hygiene, also known by the acronym WASH, access to appropriate and timely medical care, allowed to positive, respectful environment regarding menstruation and choices surrounding reproductive health. So if any of these are not present, period poverty will be the result. Couple more definitions. You will hear the term menstruator and non-menstruator instead of just saying women and girls. And for that reason, not all females menstruate, and not all menstruators identify as female. So the reason why a female may not menstruate, she may be in menopause, she may have a surgically induced menopause, such as a hysterectomy, she may be on birth control, IUD, or she may be prepubescent. And some menstruators may not identify as female, so they may be transgendered or non-binary. So you will often hear myself or others in the field say menstruator and non-menstruator. If for whatever reason I do say anything in the female form, such as a mother, daughter, girlfriend, it is being said as a mere example, and same with the male version. However, with this being said, most research has been done with cisgender females, so that is something we'll talk about later. So if I do say a girl or woman, I will specify that that is the research that has been conducted, that was the population used. So why do we need to study this? What is the importance? Why is this a public health concern? So first, there can be unsafe and unsanitary practices that occur when menstruators do not have appropriate access to period supplies. So many menstruators may resort to rags, clothing, toilet paper, newspapers, plastic bags. In other countries, you may hear of them using like hay or something else that's absorbent. Also with that being said, 500 million women and girls worldwide lack appropriate wash facilities, so they are not able to get clean water and dispose of their period supplies appropriately. You'll hear of some women just throwing their pads out into a field because they do not, excuse me, it's allergy season, because they don't have proper ways to dispose of their pads. And then 53% of women report using materials in lieu of menstrual products. So that is a significant number. Also, as you can imagine, there's going to be health complications associated with period poverty. So if you're using something other than a tampon or pad or an appropriate menstrual product, it may result in toxic shock syndrome, also known as TSS, urinary tract infections, or other reproductive tract infections. And so this also, 48% of women will use period products longer than intended. And this is done by Cardoso and colleagues. This study was done with college students, online survey, and they surveyed 471 female students, and they were looking at period inequity and mental health. So they were finding that this was a very significant problem in that population. Okay, and so when there is an inability to access menstrual health products, you're also going to see an educational and economic impact as well. So there was a small study done here where I live in St. Louis. It was done in a school in North County that's lower income. Again, very small. It's 119 students. It was a self-administered study, and what they found is that 1 in 3 girls missed school due to period poverty. They couldn't access appropriate menstrual care. You'll see varying numbers regarding absenteeism. You may see 1 in 5, 1 in 4, but in this study, 1 in 3. And then also, missing school leads to poor school performance, increased dropout rates, decreased paying or lower paid jobs upon graduation. And this is all because poor menstrual health management. So it's pretty crazy, just because you can't get a tampon. And there's also a mental health impact. Is another reason why we need to address period poverty. Back to that Cardoso study, 68% of college women who experienced period poverty in a 12-month period reported being moderately or severely depressed. So again, that's going back to that definition of menstrual health, that it really does have a mental and emotional impact. It's not just physical, and it's not just about hygiene, that this is truly a health issue. Okay, so we're going to take a minute here for personal reflection. What I like to call this, my personal thing, I call it your menstrual journey. Whether you are a menstruator or a non-menstruator, whether you're identify as female or male, we all have had an experience with periods. We have heard myths, we have our own first stories, our positive and negative experiences. We use different terminology. Ask yourself, how did your culture impact your experience? Could you openly speak of your experience? Who did you go to for advice regarding this? So I want you to take a few minutes, not really a few minutes, just take a little bit, think about this, and what is your menstrual journey, and how has it progressed throughout the years? Okay, so I hope I give you a pretty good overview. I kind of want to give you an in-depth overview because, I don't think people really know the extent of period poverty. They may be aware. So I really hope that gave you a good background of definitions and the extent of period poverty. We are going to go ahead and talk about applying this topic to our different models. We are going to revisit a couple of the studies that I've already spoken about. And so let's go ahead and start. First off, there are, again, so much. I mean, this could be a whole class. With the ecological model, I'm going to focus more on administrators here in America that are primarily female students. And then when I discuss community engagement, we're going to move overseas and look at how period poverty affects menstruators overseas. So, because again, there's a wealth of information. So I just wanted to make sure that we were able to tap in a little bit to everybody here. So let's go ahead and get started. We are going to start with the ecological model and give a little bit of background information on this. So let me get my slides right here. So we have first McElroy. He and his colleagues first started talking about this in 1988. He discussed that health behaviors were not just on the individual, but they occurred on multiple levels, and that it occurred on the individual, social, and environmental level, and all those impact your health and health behavior. And so essentially, we do not exist in a vacuum, but that everything really around us affects us. And also that these levels influence one another, they interact with one another, and that interventions are most effective when multiple levels are addressed. Okay, so this right here is a visual representation, and I wanted to go ahead and give you kind of what it looks like, and we're going to dive a little deeper into each one and apply our topic to it, but this is just kind of an idea, give an overview. This is adapted from McElroy's theory, his model. You will see different terminology in some. You will see some models have just 4 levels. You'll have to see some. Community might be over here and be more cultural. So again, but this is the framework that McElroy, it's closest to McElroy's model. Okay, so we're going to start with the intrapersonal. It's also called individual. I have kind of for our visual learners a smaller scale model here, and so that's going to be this little level right here in the center. The individual is in the center, and the intrapersonal level deals with knowledge, attitudes, and beliefs. And so period poverty includes actually the lack of knowledge regarding menstrual health. Again, as we talked, that was one of the key principles of period poverty. And so going back to that Coleman study here in St. Louis, 50% of the surveyed girls actually wanted more information on menstruation and personal hygiene. Things in Period actually commissioned a study, and 57% of the students believe their schools do not care about their needs if the schools are not supplying period products. And there's also anxiety and shame associated with appearing to be unhygienic. So, if there's afraid of leaking through your clothes, or maybe you can't afford proper period supplies, and so you're using toilet paper and it's not absorbing properly, and you have foul odor. So there is that shame and anxiety that goes with it. And of course that goes also back to the Cardoso study, where you may then start having the emotional effects of being depressed as well. Okay, so here we go. So this, we're next, we're going to talk about the interpersonal level. So that's going to be this blue one here. And we're already going to start to see this trickle down effect here. So at the interpersonal level, this is going to deal with our family, friends, and social networks, kind of our immediate connections. And so our social networks are a source of knowledge regarding our menstrual health. 75% of girls report receiving information regarding menstrual health from family and friends. So that is going to be their primary source of information. And then mothers still tend to be the primary source for menstrual health education. However, many parents still state they are unprepared to talk about this and silent when asked about sexual health. So, so if this level isn't ready and doesn't know how to talk about it, that is going to directly affect this interpersonal. So if interpersonal is silent, then this part's going to be unaware of what's going on. So you can already see this trickle down effect here and how everything is starting to be interrelated. And that's just by 2 levels. Okay, so next we have the institutional level, and this deals with school, workplace, church, gym, and other affiliated organizations. So kind of, this is start to talk about, where we work, play, and live. And so since we're talking about students, we're going to kind of discuss primarily school here. And so only 6% of girls report school as a primary source of information regarding menstrual health. So that's not really where people are going for their education. And also there is a lack of accessibility regarding period products. There's also excuse me. So there's also this period of this aspect of being disciplined. So 25% of students are disciplined due to menstrual health needs. So if you're disciplined, this is going to have that economic and educational effect. And overall, neither school or home are providing sufficient resources regarding menstrual health. And so again, this is going to all lead to some, just an area of opportunity for providing more knowledge as well as menstrual health supplies for our students. One thing, kind of veering off of the students, but still on the institutional level, their period supplies are not provided in correctional facilities, which I find very mind-boggling. So menstruators will either go without, or they may barter with goods or sex in order to receive period products. So again, there are many opportunities here at the institutional level. And so the community level, this I find incredibly interesting, probably out of all the levels. I'm very fascinated with this one. Community level, this is going to be now, I think we are on the green one here. So this has to deal with our with the cultural, social norms and the relationship between the organizations. The social norms, they could be formal, informal, seen, not seen. There are a lot of cultural implications here. again, we're moving kind of overseas here. We're going to go to India for a moment. Menstruation in India can be seen as dirty. You're not allowed to enter temple. Bathing practices are adjusted because of a menstruator. And they may also be isolated. There are also, of course, a lot of myths surrounding menstruation. One where, if you're in the ocean, a shark can detect a menstruator and then they will attack you because of the blood. I grew up in the 80s, so I am terrified of Jaws, and so I don't need another reason to think I'm going to be attacked by a shark. One myth I was told, I was in a church camp and a girl told me that you don't need to wear a tampon when you swim because the current of the pool will keep your period blood in your body. So I don't know the physics, I don't know how that works, but of course there are tons of myths that surround around menstruation. And so those are a couple. This was one of the most fascinating things that I found and that I wanted to share during my research. I wanted to look at the origins of stigma in America's society around menstrual health. So it wasn't always like that. So we didn't always have this pejorative connotation with menstruating in America. In 1893, the Comstock Act was enacted. And so, of course, we're jumping ahead and talking about the public policy here. So the Comstock Act said it basically banned anything that was considered obscene, considered sexual in nature, and therefore it was obscene. So what was included in that was any kind of menstruation product. So that was banned from any kind of advertisement. So that insinuated this idea that menstruation is dirty, it's something not to be talked about. So that was just kind of implied there. However, two companies found a legal loophole. And one was, I believe, Lysol, and they had douching products. And so they're like, here comes commercial marketing. They're like, well, we've got to find a way to get our product out there. So what they did is they said, if we market this as a hygiene product, we can then advertise it. So that's what happened. So we have not seen this as a health issue. We've not seen menstruation as a health issue. We now see it as a hygiene issue because of advertising. So it's a very interesting way to look at menstruation. Also, this legal loophole happened in the 1920s. This is also when women were going into the workforce because of World War I, and men were coming back from overseas from fighting, and so there is just this kind of mentality about blood and bloodshed and war. So you don't want to see it. Also, germ theory is coming into play as well. So any kind of blood is a no-go. So that was kind of how we came to be a society that saw menstruation as dirty. So I just found that very mind-blowing. So that's kind of our part of our community level here in America. So thanks for listening to that. I just found it fascinating. Okay, so public policy. Okay, so this is really where a lot of the advocacy starts taking place. And it is very important for period poverty when we talk about the public policy level. So this is the outer level here. what this states, so in order, we're like, why can't we just provide everybody with tampons and pads? So why can't we just focus right here? So in order for this to occur, in order for us to really affect all these other levels, right up here, government, policy, law has to essentially state that this is a need, that this is really a health issue. So we'll go into a little bit more about that. So right now there is a bill in the House called the Menstrual Equity for All Act. It was proposed in 2019 and it is still sitting there. Nothing has happened, but it basically states that to increase the availability and affordability to menstrual hygiene products, of menstrual hygiene products for individuals with limited access, and for other purposes. So this is really the idea to provide and address period poverty and provide period supplies to those who are in most need of them. One of the biggest things that is currently being addressed is the tampon tax. It's basically trying to overturn the luxury tax, the pink tax on tampons and other period supplies. And again, what this is basically saying is that it's recognizing period supplies as a necessity and not as a luxury item. 22 states still apply tax to menstrual products. Florida does not. So those of you who are in Florida, you are exempt from that. But it really does add up. When I think I read that, I think you use 40 period products in one menstrual month, and a menstruator will menstruate like 6 years of their life. So this really does add up. When you are already experiencing period poverty, when you are choosing between getting food and your medicine, paying rent, or buying pads, getting this overturned, the luxury tax overturn, is definitely needed. We next have, which is just come about this year, is the Florida Senate House Bill 1069. This has to deal with education in the schools. It has to deal with very broad bill, but it deals with gender identification, how we teach that, sex education, but of course menstrual health education is going to be included in that. And so what it's proposing is that menstrual health education is only taught from 9th grade to 12th grade. And we know that menstrual health begins way before 9th grade. It begins before puberty and it lasts after menopause. So that's something that definitely needs to be addressed. So that's currently in the House in Florida. Also, what we have as a global initiative is the MHM in 10, and this is menstrual health management in 10. It's kind of analogous to Healthy People here in the United States, except it's global and it has to deal with menstruation. So it's making sure that in the period of 2014, no pun intended with that, but in the period of 2014 to 2024, that globally we are addressing and assessing period poverty in the world. Okay, so Okay, so there we go. So that was our overview of the ecological model as it relates to period poverty, and we're now going to go on to community engagement framework. So the background of this, it has its roots in the labor movement, as well as civil rights movement, women's movement, gay rights, disability rights. And the idea of community is very subjective. So this doesn't really necessarily have to do with where you live. Community can be areas of interest, demographical similarities such as disability, gender identification, ethnicity, religious affiliation. Again, so it's not just geography, it can be a common shared interest. The one phrase, if you will hear over and over again with this framework, is going to be start where the people are. So it is this idea of collaboration and coalitions with those in the community, that really your program, your framework, your programs and your analysis of the health issue is only going to be as strong as the involvement and participation as the community members. And within this framework, there are going to be 5 concepts or principles. The first is going to be community capacity. This is defined as the characteristics of communities that affect the ability to identify, mobilize, and address social and public problems. And so you're going to identify social capital, community strengths, and encourage activity participation from community members. During this time, you're going to identify resources. They may be tangible, or it may be community awareness, their knowledge on the health issue, their perspective as well. And from these resources, you're going to encourage participation. Again, we're going to move overseas now regarding period poverty. Excuse me just one second. We're in India. We're actually in South India right now, and I'm going to introduce you to Padman, as he is affectionately referred to. This is a man, Padman, who dropped out of school when he was 12 and got married. Really, as many in that culture, females do not know much about menstruation, men know even less. And so, of course, as he dropped out of school, he had limited income, and the idea of purchasing pads was very difficult to do with their limited income. So what he did was that he identified the problem was that he's like, I cannot afford period supplies. And he then went to take action to find a more environmentally friendly way of providing menstrual care for his wife as well as his community. So then we move on to empowerment as the second concept in the community engagement framework. And so this is going to be the social action processes and outcomes whereby individuals gain mastery over their lives to increase their quality of life. And so empowerment can occur in 3 different venues. It can be psychological, community, or organizational. And again, we're going to go back to Padman. What he did, so again, he identified the need, and then he worked to find a solution. And so he engaged stakeholders. He talked to women in the community, and he designed a more environmentally friendly pad. And so he did. So again, so this took place in the community level and then the organizational level. And so he did. So he ended up making a very strong impact. Not only did he empower himself, but he also empowered the community and the women in his community. Okay, so critical consciousness, this is going to be the aspect of co-learning. So researchers, health educators, public health officials, those wishing who are basically outsiders of the community are going to act as team members with those in the community. And what that's going to require is cultural humility. It's going to be that you don't know everything about what's going on and that you need the help of the community members, their expertise, in order to fully gain a perspective of what's going on in the health issue. This is especially true with cross-cultural studies. So if you are, like we're talking, like if we're in India, if we're in Ethiopia, learning about period poverty, we have inherent biases. So, coming from an American culture, we're going to have a certain perspective. So we need to certainly be humble and understand and open to others' views. So one of a great study that was done was by Yagnik, and they interviewed women, in India regarding the adoption of menstrual pads in India. And one of the really fascinating things they found was, one, they don't have appropriate disposal. So again, we're going back to that aspect of WASH in period poverty. But also, a majority of menstruators do not wear undergarments. So how do we increase the use of menstrual pads if the menstruators aren't wearing underwear? And then if they did wear underwear, it was loose fitting. So you not only have to get women wearing underwear or wearing pads, but first you have to get them to adopt underwear that are properly fitting with elastic. So again, so this is an example of cultural humility, meeting people where they are, and this idea of critical consciousness. Participation and relevance. So this again goes back to start where the people are. We need to start at the ground level where they are, understand their needs, their viewpoint, and the community, their perspective of the health issue. We need to acknowledge community members as a vital participant of the research and planning. Without community members as vital participants, we're not going to get sustainable outcomes and behavior adaptation unless we have full participation and the community members see the health behavior as relevant. This definitely includes community-based participatory research, so including the members in the research process. And I think I've given several examples. The Coleman study, as well as the previous example with Yagnik, clearly state how important and relevant having community members be in the process of the research. Okay, so next is health equity. So this is a final principle of community engagement framework. So this is the recognition of health inequities and address disparities so that all members of the community may increase their quality of life. So this is when we're going to really address the social determinants of health. When we look especially at period poverty, we are going to see racial disparities. So those, especially we have those lower and with lower income, they are going to be affected. We also see people who are Black and Latina administrators. They are more affected as well. So we need to strive for mental health equity regarding those cultures and those peoples, and really have them as the priority population. Also, looking from back at the ecological model, we can address these at the policy level. One good example of addressing health equity was a study done by Hassan and his colleagues was the Lebanon, is in Lebanon in their economic crisis. They experienced a revolution, and it was also right before COVID. So what they found was that the government was supplying men with toiletries, and specifically shaving needs. However, menstruators did not have the period supplies. And so there were 9 stakeholders and that recognized that menstruators were not included. And so they ended up finding a way to address that issue. One limitation of the study, and it was a big limitation, was that they actually did not engage any community members. So again, when we're talking about community-based research, when we're talking about community engagement, of course, one of the big things we need to do is to include community members. Okay, so that's going to wrap it up for our review of ecological model and our community engagement framework. And now we're going to look, compare and contrast, look at the analysis of the 2 models, as well as the implication of period poverty, how health educators can utilize what we've talked about. Okay, so now we need to talk about which model works. Is there one that's better? From my perspective, I hate to ride the fence, but I'm going to say no. I think they both work really well. I think they're both needed. If we look at the research, again, there's not been a ton of research done. We need more data. So I think they both work really well. They both have their strengths and their weaknesses. The ecological model is great. It's very broad in scope. So you're able to look at all the different levels. I think we saw before how everything interacts so well. You have the upstream, downstream way of addressing period poverty. The great thing, in contrast to the community engagement framework, is that it is more narrow in focus. So you can really look at a specific community. So let's say we want to look at women who are in correctional facilities. That would be a great way to be a little bit more specific. And you can even take the community engagement framework and insert that into the ecological model. With the ecological model, again, there are multiple levels. However, it is difficult to decide which level of influence is most important to address. Is there one level of influence that is affecting another more than another level? So that's something to be addressed. Also with the community engagement framework, it can be a bit more concentrated. So can you necessarily apply it to all communities, which of course the answer is no. With the ecological model, there's much more extensive research in that area. Community engagement framework, not as much data. However, the great thing is they both employ cultural competency and encourage appropriate planning methods. So that is definitely a strength of both models. Okay, so implications for health educators and others in the health field. One is to need more research on the transgender and non-binary population. Again, as I previously mentioned, most research is done on cisgender females, so we need more research in that area. And also we need more research in the disabled community. So how does period poverty as well as menstrual health management affect the disabled community? We do know that accessing resources within the disabled community is more difficult. That may include also period supplies. So that's something that needs to be further investigated. What I am really interested in looking at is the non-menstruator perspective on menstrual health. And what I mean by that is looking at primarily the male perspective on menstruation. So the idea is that we have a rise in the non-traditional family, right? So we may have single fathers raising menstruators. We have homosexual couples raising menstruators. So we may not be able to say, oh, talk to your mother about it. So we also may have male teachers that might be a primary figure. And so these individuals need to be comfortable discussing menstruation, and they need to be knowledgeable. So that is definitely an area I'm interested in investigating. I think a really good way to tackle that would be with community engagement framework, so that way it can be very specific. But again, incorporating that within within an ecological model, so you're getting the whole framework of the society in which one lives. Okay, so we're gonna close out with some final thoughts here. Okay, so a personal application. This is kind of going back before we had kind of our personal reflection. So let's go ahead and think about what you can do as a health educator to promote menstrual health education, to combat period poverty. And it's actually kind of easy. First, use correct terminology. So, and call a spade a spade. So it's not Aunt Flo, it's a period. When we start using things like code words, Aunt Flo, riding the crimson wave, as Alicia Silverstone calls it in Clueless, our monthly visitor. When we start using terms like that, it is covertly encouraging that idea that is something to be ashamed of, that menstruation is something to be ashamed of, that we can't openly talk about. So I encourage you to use appropriate terminology. Also, if you are in a position where you are doing any kind of medical intake, medical information, medical background intake, ask patients about their menstrual health needs and offer resources. So, when you're in a doctor's office filling out paperwork, it asks, when was the date of your last period? So if you are responsible for something like that and you're discussing that, instead of saying, when was the date of your last period, have it be more of an open-ended question. If you menstruate, when was the date of your last period? I am a non-menstruator. I had a hysterectomy, complete hysterectomy 7 years ago, and there's nothing I hate more than going into the doctor and they ask me, after I've written it several times, it's in my chart, when was the date of your last period? And I tell them, and and then they look at me like I'm crazy and think that something is medically wrong with me. But this is also a very open-ended question. It allows for a conversation because someone says, I don't menstruate. I'm on hormone therapy because I'm non-binary. Okay, so, or, and they could say, whether it's, or they can tell you the date of their last menstrual cycle. And then if they are menstruating, you can then follow it up stating, so how are you on your period supplies? And then if they are experiencing menstrual insecurity, what you can then do is offer various resources, like diaper banks, Period Alliance. There are a lot of places that people can go to access those resources. So that's something that you can do. Also, another thing is donate period supplies. Again, diaper banks, if you have kids in school, you can send them in with a box of tampons. So that is something also that you can do. So I want to thank you so much for joining me today and joining me this semester.